A little look at the agenda. So Tracy has already talked to you a bit. She's going to talk about what is LeDer, a little bit about the history of the programme and what it's about. I'm then going to talk about this new focus on autistic adults that's relatively recent, that I'm sure you've heard about, the inclusion of autistic adults in this programme and why it's so important. And then I'm going to talk about how can we prevent the need for a LeDer report. Because those of you who know a bit about LeDer already know that kind of the ultimate and I guess best case scenario is not needing that report in the first place. And then Tracy will talk about how to report that death to LeDer, to the programme, to track things. I can see that things are being recorded, so that's all good. So we're going to crack on. The hope is that this will be less than the hour, so fingers crossed we get some time back at the end. So please pop any questions that you would like answering in the chat. So I'm going to pass over to you, Tracy, for your first section.
Right, are you able to move the slides for me?
Yes, very much so.
Thanks. Yeah, so my name's Tracy Brennan. I'm the Senior Manager for LeDer and Health Inequalities over in the east of England. We're now called NHS England, and we're a collaboration of a range of organisations now, including Digital Improvement, Health Education England, as of the 1st of July. So yeah, this slide was done before that came about, and I've got a new logo, but please, that's where I'm from. Do you want to go on to the next slide? So I don't know if everyone is familiar. There is something called the long-term plan, which was being written by NHS England, outlining some key priorities around learning disabilities and autistic people. We used to be called as a team the Transforming Care programme. So people might know that it originated from there, and it was related quite significantly to the number of people with a learning disability and autistic people who were inpatients in mental health settings, and about the importance of discharging those people. Following then came on board when the LeDer programme started, and we'll go into LeDer in a minute, but I have picked out the key priorities for the long-term plan that relates much more to health inequalities, and the emphasis of the health inequalities element came about from a report by Southern Health, where it was recognised that people's care in hospitals wasn't very good when people were dying in hospital from preventable conditions that were more related to physical health, and also around the introduction of building the right support, where we talk about annual health checks as identifying ways of improving people's physical health and recognising symptoms and signs much earlier. Autism has always been a bit of a sideways, and you know, we always call it the Learning Disability and Autism programme, but I have to say it's only in the last 18 months that I think my focus has really shifted to really understand autism and the impact of autism. So we talk about annual health checks, for instance, and it's only people with a learning disability and have autism who would have that, and it really identified that there's gaps in the support that's needed for autistic people. So we're doing a lot more work in the focus on listening to people, autistic people and their families. And we're sat here today with Autism Bedfordshire, who are our regional partners, led by Bex, who's an absolutely amazing support to people to understand the feedback of their experiences and the stakeholders' experiences of health inequalities amongst autistic people who don't have a learning disability. With that information, we take it to our regional panels and look at how services are commissioned. I can see there's quite a few people from learning disability backgrounds, and I think what we're seeing is, where does autism fit? So today it was to also understand maybe even in the questions section, who would be people that would notify deaths of autistic people? Where are they being supported, of those who don't have a learning disability? Because I think, you know, the commissioning of autistic services for people, autistic people, is quite diverse, and quite often sits under some mental health services, but other people have services that are combined alongside learning disability. So we want to use the work that's happening with the people with lived experience and use that information, as I was saying, about informing care, and the needs of services. And there's quite a number of regional groups. There's a neurodiversity group for young people, which is looking at a wider range outside of just autism to look at what service needs are needed that will lead people into adulthood, as a starting point. But there is a real need and recognition that we haven't been doing that up until now. And obviously through LeDer, we want to be able to make sure that people are kept healthy. As it says there, LeDer is learning from lives and deaths of people with a learning disability and autistic people. It's always been called LeDer, and I say always, the program's been running now for about 5 years. It's quite embedded around learning disabilities, but as of the beginning of January, it was recognised that autistic people might have other reasons why that they might be dying earlier, and this needed to be looked at. Do you want to go on to the next slide? Yeah, so this goes alongside, I'm sure Bex will pick a lot more of this up. It goes alongside an autism strategy that's been refreshed last year, and again picked out elements of work that needs to be happening, which hopefully across your region you're familiar with pieces of work taking place around identification and diagnosis. Really important. We know there's quite a long waiting list of people who recognise they have maybe traits, as we call them, or behaviour that might relate to being autistic, but until they have a formal diagnosis, obviously they're left in a bit of limbo and probably quite challenged, find services quite challenging to navigate. Wanting to improve the understanding of autism, particularly autism without a learning disability alongside learning disabilities, and that will be supported by the Oliver McGowan mandatory training. Now, the mandatory training was passed by Parliament probably about 6 weeks ago now. It has been piloted by organisations such as Build and NDTI, and hopefully now, as the pilot demonstrated some really good outcomes, what will happen is that it's being evaluated to understand how it can be implemented and who would be the best people to make that happen. Possibly will require, I think, a consultation based on that, and hopefully it'll be in place before the end of the year. It says mandatory. Obviously, that means that all people who are health and social care staff would be expected to receive training in learning disability and autism. There is a programme called Stamp, which is Stop Over Medicating People with a Learning Disability or Autistic People. I've just related Stomp in this case, but there is a programme related to children and paediatrics, identifying a reduction in medication around those young people before they're even prescribed, and that's called Stamp. But that's really important, because we know the first port of call quite often is if someone's then diagnosed, the first expectation is that maybe they'll be put on medication, and obviously there are other opportunities to support people, such as positive behaviour support, or just giving people strategies, and the amazing work that Autism Bedfordshire does in the background for other support mechanisms could be an alternative to Stomp. Currently, just like learning disabilities, there is a trial taking place in the North East around annual health checks for autistic people. That won't be in place for a couple of years because it has to be evaluated once it's been trialled. But I think it has been recognised that, again, something around a health check would be beneficial specifically to people who are autistic. It might not need to be annual, but it was helpful to be able to do the first part of the pilot to see that. Obviously LeDer, and then improving the mental health of autistic people. And again, that's around identification, because we know that there's a lot of autistic people without a learning disability who might be undiagnosed in mental health system, or receiving a diagnostic whilst in health settings. And we need to make sure that when they come back to the community, they receive the right support. Next slide. So I'm not going to touch this because I don't know, Bex, am I stealing your thunder? You can nod. No, not yet. So there was a report done by an organisation called Autistica. I kind of left that the line of which report it is, but I'll try and put it into the chat later. Autistica is a national organisation. They do research around autism. They do a lot of different types of research, so they're always handy to link in with. But they did a piece of research around health inequalities amongst autistic people and identified that actually there wasn't very much in our country, but they looked towards, I think it was Sweden, to identify issues and see what's common. And actually there's some, there has been recognition that there's some quite interesting findings around health inequalities around autistic people that we might not have recognised previously. So we've talked about a higher occurrence of epilepsy. We know that there's seen to be a higher prevalence of mental health issues, but other areas of conditions such as strokes, circularity, oh gosh, sorry, excuse how I say that, are ones that we would see in people with a learning disability as well. And we probably didn't see those comparably. Cardiovascular and diabetes actually are quite interesting, because in learning disabilities we see quite a lot of issues around weight management and around supporting understanding how to support people with a learning disability with weight management, and possibly there could be connections there again for autistic people. You know, some of that would be even not necessarily being overweight, but actually being underweight. And again, we've met with people with autistic people who have reported back that they have restricted diet and actually do restrict their own diets as a result of their autism, just because, not because they have an eating disorder, although it would be recognised as an eating disorder, but because they also just their brains, they would say it themselves, their brains just don't connect to think I must eat, and suddenly they're losing weight, and people think that it's because of the fact that they're deliberately doing that. And we've spoken to quite a few people with autistic people with that kind of feedback, that actually needs different services than eating disorders. There's something different around that level of eating disorder. Cultural pressures, so and as a result, we know around social integration and feeling as though people aren't able to conform, and obviously we see that this results in some masking. Sensory overload has been reported as a big issue that leads to health inequalities and just not being able to engage. Again, we spoke to somebody who was really engaging in a previous webinar, actually, who talked about the challenges they face in going to contact their GP and going into the environment and then going to hospital. And if you get a chance, listen to a previous webinar with to listen about their experiences, because I think for me that's probably been one of my hardest hitting findings from working with Bex, in listening to things that actually are free to change. We talk about reasonable adjustments all the time, but actually their experiences can be transformed really without any cost. It's just the thought of people. So and I think the sensory overload is about accessing healthcare as well. But other areas are in the same way. There might be poverty and social deprivation, again about accessing healthcare. I see in the chat, Bex, they would quite like to see that webinar. I think that one's a really helpful one.
We've got a link to the direct video at the end, so I'll be able to get through.
Yeah, and actually probably for me, the first 10 minutes was the hardest hitting, and then at the end, the presenter also talks about some good examples. So if you can at least listen to the end as well. But in between that, there's so much training around sensory integration, which is really useful. So that was a really positive webinar. So as I say, what is LeDer? It is Learning from Lives and Deaths. It is a service improvement programme. So it is not a safeguarding, it is not a investigation. It's purely to improve services so we can identify what the themes are and work with people. For each ICS, an integrated care system, which was introduced last week, for everybody, now it is a mandatory, although it's not statutory, and it's really worth pointing that out. All systems are engaged in the programme. They have been for a while for learning disabilities, but I think today what we really wanted to point out is that we've not, since January, ever had any notifications around autistic people. I'm not saying that the expectation is we suddenly want an influx of around notifications, and maybe that's a good sign that maybe the services are there, but from speaking to people, autistic people, that isn't really the case. And so we just wanted to make sure that people are aware of the programme today. So it is about improving the care, and once ultimately we understand what the needs of people are, hopefully the care will be improved. That will in turn reduce the health inequalities and hopefully prevent people from dying too young. So for those that are not familiar with LeDer, apologies to those that are familiar with LeDer already. The review looks at the key episodes of health and social care. So it is an integrated piece of work with a number of different services. So you may be contacted if someone was known to you who was an autistic person who passed away, and you would then be involved in engaging in the review. The review looks at, can go back as far as 2 years, so it could actually go back, or it could go back as far as then their diagnosis, if someone was diagnosed later in life. It could go back to a couple of months where their health deteriorated. It just is picked up by a professional reviewer to identify and take a professional judgment when that review should stop. Also quite reliant on the support of our primary care colleagues, our secondary care trust colleagues, mental health, wherever we can get information from, because that is where they will be able to tell us the actual the information accurately. The reviewers themselves are clinicians or social care professionals who are paid solely to do LeDer reviews. They are employed by each of the ICSs. It's a workforce model that is independent, and then any reviews that are done go then on to a local area contact which sits within the ICS to review those findings and take those actions forward. There is a information sharing agreement which has been set up to make sure that if anyone contacts you, that there is IG has been covered to allow their notes to be shared. So the individual, if you have notes and information through social care or GP notes, that in the same way as the Learning Disability LeDer programme, it has provided, you provide notes to that. The same, it's called a CAG, and I can't remember what CAG stands for, a CAG 251, but it's basically the Secretary of State has given permission that in this case it's in the best interest to ensure that information is shared in order to we can make sure that things are improved in other ways. Do you want to go on to the next slide? So I think what's really important is highlighting who would be in scope for a autistic person who would be included in the review. So again, I suppose where our reviewers or our local area contacts, particularly in each of the ICS, are having to do a bit more delving into. Quite often someone with a learning disability would be known to their GP as having a flag or a code, SNOMED code, which would be easily identified as someone with a learning disability, or we'd work with social care to identify that person. It's slightly different with autism. We're not relying on SNOMED codes. We're looking for diagnosis. So we're looking at a specific confirmed diagnosis. I apologise for the dog in the background. It's my neighbour's dog, not mine. My office is in the garden. So, and you know, we find that really hard because we know that there's got to be a bit more work that goes into that. But it doesn't identify those that are who identify themselves as autistic, or someone who's just said, oh, you've got autistic traits, or could be, or on the waiting list to have a diagnosis. The other part of the programme is that we're only working with over 18-year-olds, and as I've just put in below, all children who die under the age of 18 would have a child death, go to a child death overview panel, so all deaths of children are already reviewed. So for a LeDer at the moment, for autistic people, we're only specifically looking at adults. However, with learning disabilities, we do look at the children, but that's only gathered from the CDOP information. And what we hope in the future is that we'll still be able to gather further information around children who are autistic, who might die early. But at the moment, that's not been confirmed. Do you want to go to the next slide? So just as an indication for those don't know, what we'd be looking for is a diagnosis under the DSM or ICD, and the links are on there as to what they would form around what those how that person would then be diagnosed. And they are that's our criteria. Within those documents, they've been updated so many different times, but we might see in notes that someone might use other terminology, and although we don't generally use that information anymore, the terms are still recognised. We still have people who say that they have Asperger's syndrome, and actually, whilst we much more relate to ASD or autistic spectrum disorder or autistic spectrum condition, we recognise that a lot of this information might still be familiar to people. Do you want to? So that's kind of a bit of an overview of what the LeDer programme is. I'm just wondering, can you see any questions, Bex, in the chat?
Let me just pop out for a moment and have a little look in the chat. Okay, so I can see a couple. Is there a statutory requirement for the recommendations from any LeDer review to be implemented?
So health inequalities is such a big profile across all of the integrated care systems now. I just came from a meeting prior to this where we have a quality panel, so there are statutory obligations such as Mental Capacity Act to move into LPS, and obviously with those statutory legal obligations then we would be still following those up. So of course there are elements that we would be ensuring that sorry, someone now has decided to do building work next to me. So we'd be ensuring that those are being met. And what we do see that within learning disabilities, which we're waiting to see within, if that is a theme, that actually that is recognised that Mental Capacity Act isn't always followed, and as a result we've seen cases such as the Oliver McGowan case, who he was autistic but had a very mild learning disability, but again the Mental Capacity Act wasn't really applied in that case. So we know that statutory requirements are not always being followed, and then there is also obligations around the Equalities Act and where reasonable adjustments haven't been made. So there is a legal framework and statutory obligations that need to be followed, but most of them are mandatory. But I have to say, because of the higher prevalence of health inequalities generally that we've seen, and some of that's been pushed by COVID, there is something called the Core Plus 5 like piece of work that's taking place across NHS England and what was public health to ensure that those groups are the health inequalities of those groups are reduced, and within that learning disability and autism are one of those 20. Don't think that answers. Otherwise, it is the responsibility of all ICSs, and it is being followed. And part of it is we really want to make sure that we involve families and people with learning autistic people to be able to ensure that those changes are being met, because that's how we're going to know that things are working.
Great, thanks, Tracy. Someone has asked, does LeDer also include suicide?
Very much so. Obviously, there's lots of areas do their own suicide review, but I think what's really important is that when we think LeDer, we think collaboration, and if there's other reviews going on, that we work alongside that and make sure that if you've got links into other places where reviews are taking place into situations such as suicide, or things like the domestic abuse reviews that often take place, that that's also engaged in the LeDer process, and you'll get quite a better in-depth understanding then, because you'll be looking at a greater area of time than maybe a straightforward suicide end of life might be looking at. But yes, I think what we're going to see from the rest of the country, for those that have had notifications, is that a high number of the notifications will be due to suicide, which is really hard to hear. But we know, having spoken earlier in my presentation, sensory integration might be a key area of recommendations of how that is implemented across health and social care as a way of reducing that health inequality. Oh, you're on mute, Bex.
Oh, so I am. Thank you. Nimala has asked, is the LeDer review only after death or before if their needs have not been met?
So a LeDer review will only happen once someone's died. At the very end, I'll show you the screen, and they give you the link as to how you would make a notification. But it's very much once someone's passed away that a notification will take place.
And then, is the Oliver McGowan training being rolled out across NHS trusts, as I haven't heard of it yet?
Yeah, so I think I mentioned just a little bit earlier, at the moment it's gone through Parliament. It's become mandated that everybody in social care or health will receive the training or be expected to meet the obligations of the training. The training itself has been piloted, it's been reviewed, and at the moment all they're looking at is how it'll be rolled out, because the pilot was was really good, but it will need a lot of coordination, and who will be then delivering it, because obviously they commissioned a service to do the pilot, but each area will need to look at how that can be translated in the same way the pilot was run locally. So following that, we'll probably need a little bit of a consultation to tell people what the findings were. So I would say the back end of this year, we're hoping to see that it'll be implemented. Alongside that, already CQC have already included it in their training modules as having to have training in learning disability and autism. I have gone back to Health Education England, or NHS England now, to request an understanding of what a CQC going to be measuring that on, because if you're a provider and it's already in the training manual but the training isn't there yet, what are they going to be looking at when the training isn't available, but yet it's a mandated training requirement of the trust or of a provider.
I have got one here from Erica. When will the government make a decision about annual health checks for autistic people? Is there another year or so until the Newcastle-led trial is complete?
It isn't so much the government. I think there's an agreement that that it should happen. I would say it's when that pilot's completed. So we've already, our early findings are that it was a very positive in a very local area. The next step would be rolling out the trial check itself wider across the country. So we're looking at GPs who might be interested in doing that, and then we'd want to measure it. And because an annual health check is only once a year, we'd probably need a year to be able to see from first check to the second check whether or not anything's changed. So it will be at least another year away yet.
The questions are still rolling in, Tracy. Thanks, everyone, because I was worried that because of the heat, everyone was going to be gently falling to sleep, but this is not the case, so thanks so much. If there are recommendations for a specific organisation from a LeDer review, does that organisation have a duty to implement the recommendation other than an MCA recommendation?
Yeah, so at the moment, once someone's review has happened, it goes to the local area contact. That local area contact then takes it to a panel, and around that table is representation from both the trust, from the ICS, what used to be the CCGs, it would have the community providers, social care. And as a group, they would recognise those recommendations and then be expected to take those back to their own organisations. So by them signing up to the panel as part of the integrated care system and a partnership, that the expectation would be, yes, they would follow up the recommendations outside, even though they might not be statutory, to make them happen within their own organisations. Some of those would be very strategic and be coming down from more national priorities, such as changes to legislation around MCA. But ultimately, there could be other ones around looking at cardiovascular, which we mentioned, and seeing the prevalence. So first of all, doing some research on prevalence amongst autistic people, and then making sure that that is addressed within their own local area. I would say that probably one of our biggest challenges for me anyway as a regional representative is that we look at learning disability and autism programme slightly in isolation, and what we're trying to make sure happens across the region is that where an issue around a physical health condition is there, that it's everybody's business. So for instance, we know that from learning disabilities, respiratory condition is our highest number of cause of death amongst people with a learning disability. Obviously, we haven't got any information yet for autistic people because we've only just recently started this work. But from a respiratory side of things, we are expecting that respiratory pathways would be within the respiratory teams themselves and not a learning disability specific part. You know, what we're keen to do is ensure that learning disabilities forms part of a wider group, and that they're considered in that group, as opposed to it being we have to do everything very specific to learning disabilities. We want to make sure that people are included where possible in mainstream services, but their needs are considered, not just added in and expected to attend those services.
Great. I've seen two questions that are then going to be our final ones from Suzanne and Alison. So Suzanne is asking, how do you manage the timing of LeDer reviews, particularly with family members who may be grieving?
That is, again, another really challenging one. So nationally, there is a key performance indicator for all systems that a review needs to happen within 6 months of that notification being made. So I probably didn't emphasise the fact, and thank you to Suzanne who actually raised the importance of the family, but a key discussion point is having a conversation with the family as part of that review. So you would look at clinical notes, speak to people who knew that person on a social care or a provider or a clinical basis. But alongside that, really important is we need to know what that person was like and really have an opportunity to share their people's experiences and whether they were good or bad of services, but also to give that person, that family member, time to talk about the person they loved. And actually it is difficult to choose a time. They're written to, they're asked, they're spoken to tell them about the programme, and it's their decision whether or not they decide to be included in the reviews. And you know, that's a tricky situation, but the ones that are involved really appreciate that opportunity to talk. So we would always expect a review to be done within 6 months of that notification to take place. So I'd say the timeline, if anything's within that 6 months, but you might have a family where a notification happened 2 months earlier and they might want to be involved, but other families might say, can you give me another couple of months? And that's okay, because it's within the 6 months, as long as that kind of information is gathered and they note it on the platform. The reviewer will come back to them and see how much they might want to talk about that person.
Great, and then we'll answer this last question. And I know there are still ones popping up, and hopefully at the end, if we've got time, we'll come back to some of those, or we'll follow them all up. We'll make sure that you get an answer post-training. Alison says, is the training, so this is following on from Oliver McGowan, is the training for all NHS social care staff or just those who are front-facing?
No, there's 3 stages of the Oliver McGowan training. So first of all, everyone would be expected to have stage 1 of the training, and that would be, we're unsure, that's the bit that they're working on, how we'd make sure that everybody gets that training. Following that, depending on the level of involvement of the individual in working with that individual, there would be there's other training that's being developed. So for instance, there's very specific training for inpatient units of mental health settings, not learning disability settings, for mental health settings, for in order to train staff to know how to support an autistic person in an inpatient unit. I'm not sure where the other 2 elements are, but the first part, the really important part, is that first section. So there are other bits of training, but it is dependent on what involvement you have that person. But ultimately, everybody should be doing the first section.
Great, thanks, Tracy.
No, just go to Dorothy. The person, the autistic person, wouldn't have an annual health check just yet, but and it is a very much a something that is down to the individual to make a decision. As long as they have an informed choice and they see the benefits, that's really important. If they've got a learning disability and autism, they can go, obviously. Again, it's about that understanding what benefits are, but the autistic, someone having a health check if they're autistic isn't in place just yet. We're just piloting
it. Okay, I'll try and skip quite quickly through this so that we do have more time, because there are some good questions still in there. Hopefully, oh no, it's not going to let me use computer sound, is it? Okay, well, that might work better, because I was going to share a video with you, but it doesn't look like today it's going to let me share my sound. But I'd love for you to, after this presentation, see it, but we'll get through to it in a minute. So talking about why the new focus on autistic adults is important, and I just wanted to kind of throw some stats your way that I'm sure some of you have seen before and are not a surprise to everyone. But this is why we're talking about why it's so important, because as Tracy was saying, LeDer reviews are trying to prevent early death, and autistic people die on average 16 years earlier than the general population, which is a huge chasm of a kind of gap. So we want to make sure that we can learn from when things are happening and why. It was interesting that someone talked about suicide earlier and asking if that's included in the review. And again, autistic adults and without a learning disability specifically are 9 times more likely to die from suicide. And so these are all really big, scary figures that kind of really emphasize why it is so important to now be focusing on autistic adults within this program as well. And also autistic adults with a learning disability, 40 times more likely to die prematurely. They're kind of really, really big figures and big stats. So just wanted to kind of really emphasize that. This is why we're talking about it, and this is why we want you to know what to do if you can report something to the LeDer programme. So this is kind of going back on those stats, so 16 years earlier. And so it's incredibly important to be a part of this programme for autistic adults because they're facing unacceptable health inequalities, and it's often due to a lack of autism understanding. Now, we've mentioned Oliver McGowan a couple of times, and I would so highly encourage you to Google Oliver McGowan and go to the website and watch the video of his mother talking about his story, because it's incredibly moving, and I think really pulls to light the kind of importance of not having as many cases like that, right? Of stopping them as much as possible. Lots and lots of our past trainings have talked about these inequalities that autistic adults face. And over the next couple of slides, I'm kind of going to glaze over a few. So I really encourage you, I'm going to have all the links at the end to go back and view some of those workshops that we held, where you can really hear from autistic adults that we talk to what these inequalities are for them and how that affects how they access healthcare and how they engage with healthcare services. And then talking about primary care as well, this kind of 80% of autistic adults reported difficulty visiting a GP. And we know that a GP is a challenging situation, especially if it is something that you're worried about. But you can see that's versus 37% of non-autistic recipients. So it really is bigger and more of a challenge visiting a GP. And the importance of that is kind of not identifying things earlier, right? If visiting a healthcare setting is a scary, uncomfortable place to be, and you don't feel understood and you don't feel like you can communicate with your doctor, who potentially is your first port of call, that's really going to impact kind of how maybe the condition that you're facing affects you, how you get help, how you're able to access support. So again, just wanting to emphasise why it is so important. And this I was going to show you, but to be honest, because of time, it's probably better that I'm not going to. But please, please, can I implore, as soon as this session's over, I'm going to send you all out this deck with these links, that you go and have a look at this. And it's a 3-minute video. Oliver McGowan's mother talking about her experience and his experience that led to his death. And I just think it's so important to hear and listen to. So please, please do. I'm not playing it to you now, but I really do encourage it. So we're obviously talking about the kind of worst case scenario, right? Someone dying as a result of maybe things not being picked up in the right way or understood. And so obviously with that comes a need to prevent that in the first place. As Tracy said, we do need to know as much as possible like where these things are happening, and we need deaths to be reported. But equally, we want to try and not get to that point where that is needed. And so I'm just going to take 3 kind of key things. And again, these are fed through in lots of the courses and lots of the workshops that we've held in much more depth. So please do go back if you want to hear a bit more, but just kind of talking about it and putting these 3 specific things as important things to think about. So everyone is unique. All autistic people are unique, and it's so important to take the time to get to know that individual patient's needs. And Tracy kind of mentioned it earlier, talking to family, talking to other professionals who know that patient. And in Oliver McGowan's story, that comes up quite a lot. His mum didn't feel like they were talking to past professionals who'd worked with him on a weekly basis for many years and knew him far better. They weren't listening to what he said, what his family said. And actually, it's so important not to kind of put someone in almost a basket and assume that this is what they need. Talk to that person and the people that know that person well. And flagging things on the system. I know kind of there are various different things that are able to do, but if there are kind of needs or reasonable adjustments that are identified with a patient, can you in any way inform other people that they're going to come into the path of as well, so that everyone is looking out for this person in the same way? I've kind of alluded to reasonable adjustments already, and it's still so important. reasonable adjustments obviously are things that could be adjusted to a specific environment to help support that person in getting the same access as anyone else would. So lots of things to think about. There's a kind of a bigger video that I'll have a link to in a moment, that is some of our adults that we talk to talking about the different reasonable adjustments that make things feel better for them and make them able to access things in a better, easier way. And here are kind of some examples of those. So some of our autistic adults struggle with like time to process. So a short appointment, a normal size appointment, they can't process what's being said to them and able to kind of ask the questions that they maybe need to, which leads to lots of adults leaving appointments and feeling like they still don't know what's going on, or they haven't asked the question that they wanted to ask. So double appointments to help support that. Really thinking about sensory environment. One of our previous workshops is specifically on sensory, so if you're interested in that, go back and have a look, but really thinking about things like a ticking clock, and I guess making notes on that patient if you recognize that a patient is really sensitive to noise. Informing other colleagues so that maybe like it feels like such a small thing, but putting a ticking clock away into a drawer or into another room just to help that person focus more in the moment, thinking about smells, thinking about sounds. Using a different type of appointment. Lots of our adults have talked about finding different communication methods more useful than others, and like they're able to connect. So thinking about things like that. Quieter waiting rooms. Often there's a space that people can go to if it really is too much, being in that really busy space. Making sure that you've got easy read booklets of things, visual stories, offering autism passports, hospital passports, which are kind of ways that individuals themselves can tell you about them and what helps them and what hinders them to kind of move forward through things. So there are links through those words, so please do go and check them out, and finding other forms of communication. Making sure that you know how to communicate with that person and you've got a method. And if you haven't, trying to work out what that is. I guess it kind of rings true with lots of the Oliver McGowan stuff and what his mother was talking about, and kind of the environment that he was in maybe not necessarily helping to support him. And so rather than if kind of someone is behaving in a different way than you would expect usually, can you consider like that might be to do with something that's different in your environment or something that can be changed. I think it can be very quick sometimes to point the finger at the person, and actually is there a way that the environment, it might be such a small thing, can be changed to just make that person feel a little safer and a little more supported. And we've obviously mentioned Oliver McGowan training. Like I guess my final point and thought is just to take the time to better understand autism. And I know that time is a luxury, and lots of us don't have the time. The Oliver McGowan training will become mandatory, and as Tracy has said, like there's all sorts of talks about rollout and when that will happen, but that is now mandatory. It's been passed in Parliament, that is coming. And I know a couple of you have said that you've done the pilot for the training, and it is good, and it's working with autistic adults as well to understand them while they present kind of what their experience is. So really, really positive stuff. And then I've got a whole link of online resources here that I have found really useful. So there's a TED Talk for those of you who like a TED Talk at the top, which just challenges the perspective that I think lots of people have of kind of what autism we thought of was historically. The healthcare environment, what can a healthcare environment feel like for someone with sensory sensitivities? Now that's the one that Tracy was referencing earlier on, right at the beginning of the session. One of our members talks about what it feels like for her to be in that environment really eloquently and really movingly. So really would encourage you to watch that. The Can You Make It to the End one, I think, is a National Autistic Society one, but it's about a child moving through a shopping centre, and it's showing that sensory impact. And it's just really, really good at showing you exactly what that feels like, and the panic and the pain that it causes autistic people sometimes. Autistic adults, what makes communication easier for me? That's some of our adults during this project talking about different things that have made communication easier. And then there's a nice message to the public. I think, again, that's National Autistic Society, but challenging perspectives of what autism is, because I think that's what a lot of this is. It's not what was taught even kind of 20 years ago, 10 years ago. Like, things have changed. So making sure that really is shifted. So yeah, like I said, I'll send this on really kind of afterwards. Here are the online workshops as well, all online through YouTube, easy to access. Please do go ahead and have a look. I'm sorry, Tracy, I've left you with very little time.
No, that's fine. I just feel bad I took most of your time. So I've just seen in the chat, just the hospital passport. I presume in your presentation it goes direct to the link, and the workshops in the presentation it goes straight through. Just as another point, people were asking about recording reasonable adjustments. Every GP has a list of codes called SNOMED codes. There are reasonable adjustment codes, not necessarily, there's autism codes, but there's also reasonable adjustment codes. And I would urge, if you go to a GP or you know someone who's got autism who would benefit from a reasonable adjustment, that it's noted on those codes, and then a GP would already know automatically if it's a different GP. So just very quickly, as you know, it only started in January that people with autism without a learning disability can be notified. Anybody can make a notification, and then it's the responsibility of the Integrated Care Board and the integrated like the ICSs themselves, integrated care systems, to be able to carry out that review. So it is a formalised process. I'm just going to really aim quickly, because that is the front page of the review, the link to it there. And I don't know, before it's sent out, Bex, you might want to just hyperlink it directly, because I don't think it hyperlinked for me. And it's a really simple form. If you're not too sure about the person having a formal diagnosis of autism, I would still urge you to notify, and there are people that will be able to do a bit more of a dig on that. But as I say, it's people who haven't have been formally diagnosed who will have the review. But once we know that person, just for IG purposes, if they haven't got autism, we would be then closing off the case and taking it off our information, because we don't want to breach any IG. But yeah, so that was my final point of where to go to get that information and how to make a notification. So hopefully, I don't think we've got time for questions.
I don't think we do, but I am going to go back and look through some of those and try and get you an answer sent over, because there were some really good questions in there, and like, just really appreciate you all attending, and spread the word, right? We're going to create a recording of this. If you know of other colleagues who weren't able to make it, forward them on the recording. The recording will take a little longer, but I'm still going to send out the email straight away with this presentation so that you can access any of those resources ASAP. And oh, thanks everyone, lovely comments coming through. And yeah, we're really grateful that you've joined today, so thank you so much. Thank you, Tracy, for presenting. Thank you, Saida, for saving the bacon and admitting people in at last minute. So thank you very much. Have a lovely day, everybody.
Thank you, everybody.